How's your heart? Do you have a good heartbeat and regular and excellent blood pressure? And do you ever stop to take your pulse? And would you know how to? Because according to the Arrhythmia Alliance, it could potentially save your life. Cardiologist Rushkan Syria joins us on the phone. Hello there, how are you?
Good morning, Naomi. I'm well. Thank you for having me on your show.
You're welcome. Let me ask you, though, is monitoring your blood pressure and your pulse the same thing?
No, they're slightly different. We call them both basic observations in medicine, but your blood pressure really has more to do with the forcefulness of the heart's contraction combined with how difficult it is for the blood to get around all of your arteries, whilst your pulse has to do more with the regularity of the beating, whether it's regular or irregular, a bit like music.
Okay, so we're talking about arrhythmia today. And is arrhythmia something that only happens to older people or people who aren't very well?
No, that's a really good question. So we actually see a wide range of ages. We do see more arrhythmia as we age, which is one of those unfortunate things about getting older. But I do see patients in their late teens right through to their late 80s, 90s and even older. But you're right, the majority are people over the age of 55.
How serious is the condition?
So the most common arrhythmia is one called atrial fibrillation, and that is quite common, about 2% of the population, and that is very serious. It's something that we neglected for many decades, but we now realise is a very important risk factor for stroke. So if you have atrial fibrillation, compared to someone who doesn't, your risk of stroke is increased 7 times, and your overall risk of dying is increased by a factor of 2. So if you have atrial fibrillation, your risk of dying is doubled compared to that of your peers who don't have the problem. So it's very important to know about it and get it treated to reduce the risk of dying early from it, as well as getting a stroke and being debilitated from it.
Okay, so what makes a heartbeat irregular?
Yeah, so the most common thing is a condition called atrial fibrillation, where the normal timing mechanism of the heart gets hijacked, so to speak, by other electrical impulses in the heart. And these cause the heart to beat irregularly, and it loses the synchronization of contraction, which then increases the chance of clots forming in the heart, and that's how the strokes can occur in this condition.
So can you feel arrhythmia when it's happening to you?
Yeah, that's a really good question, because in fact, one of the really tricky things about this common problem is that a significant proportion of patients don't have any symptoms whatsoever. And in fact, sometimes, for very unfortunate patients, the first sign that they have something wrong can in fact be when they have a stroke. So it's very important that monitoring is undertaken and that awareness about this condition is increased.
We know that stress isn't good for the heart, but can stress cause arrhythmia?
Absolutely. So this is something that's really hard for us to research, because how do you quantify stress? But we can look to stressful events such as the 9/11 attacks, and we can see increases in general in cardiac admissions to local hospitals. And by that, we can definitely extrapolate a link to stress. And in my practice, absolutely, I feel that stress is very important in causing these types of problems.
We're speaking with Professor Rukshan. We're serious. Sorry about that, Rukshan.
That's okay. It's a tricky tongue twister of a name.
It's a great name. And we're talking about arrhythmia and the importance of taking your own pulse. Can't we assume, though, Professor, that when we're at the doctor will pick up any problems that we might have with an irregular heartbeat?
This is absolutely correct. The local doctor, your family GP, is the person who's most likely to pick this up. I think it's always useful to just bring it up in conversation if you are over the age of 55. A frightening statistic is that after the age of 40, beyond the age of 40, all of us have a 1 in 4 chance of at some stage developing atrial fibrillation. So it's extremely common, and the family doctors are very much in tune with this and will be checking your pulse and blood pressure regularly because they know that these are 2 factors that critically impact on your risk of stroke. And stroke, of course, really is very detrimental for quality of life, but also potentially for quantity of life. So you can die, of course, from a stroke. You can assume that, but the problem is that your interaction with your family doctor is going to be usually a few minutes, at least in terms of the examination. And if by chance your heart is in normal rhythm at that moment in time, the problem can easily be missed, and that's not anyone's fault. It's the nature of the problem. It can be a fleeting problem, so it can come and go like a thief in the night, and quite reasonably people can miss it. And so it is fairly important for patients also to be aware of the problem and also to know how to check their pulse, because, of course, if the patient knows how to check their pulse, that's far more powerful than just having that occasional check when you're in with your GP or when you're in at your chemist getting your blood pressure check.
So how often and when should we check our pulse?
That's a very good question. I think the answer is the older you are, the more often you should be checking it. For example, we know that the overall incidence of atrial fibrillation is about 1 to 2% of the population. However, we know that that increases dramatically as we age. So, for example, 1 to 2% of the general population, 5% of people over at the age of 65 have a history of atrial fibrillation, and then over 85 it can be as high as 15% of the population, which is a huge percentage of the population. So I think the older we get, the more frequently we should be checking our pulse. As a rough estimate, I think when you're younger, when you're under the age of 65, it's reasonable to check it about once a month. These are just my rules of thumb. They're not anything that's mandated. But I think that once you get older, it's very reasonable to be checking it even as frequently as weekly. Because if you do pick something up, you can then follow up, get it checked with an ECG at your local family doctors. And that could be really critical in preventing a stroke in your particular case.
Professor, I remember when I was at high school they taught us how to take our own pulse, but I really can't remember how to do it. Can you tell us how we should check our pulse, what the procedure is?
Sure. So we usually check the pulse in one of two places or teach patients to check the pulse in one of two places. The safest place is just at your wrist, near your thumb, and we call that the radial pulse because that's where the radial artery is. That's the one most people are familiar with, and if you need help, you can Google how to take pulse on the internet, or alternatively, if you're not that comfortable on the internet, you can just go and ask your GP to teach you, or you can ask your chemist or your practice nurse in your GP practice to teach you, because it's really, really very simple. Now, the interesting thing is that if a patient is in atrial fibrillation, the pulse can become very difficult or even impossible for a beginner to feel, so that in itself should put up a red flag. Apart from the radial pulse, the other place you can feel the pulse is in the carotid, in your neck, which is right near your trachea, which is that sort of hard bit of tissue in the middle of your neck, and just gently, very softly feeling next to that with your fingers, with your index finger, you'll generally feel your pulse. Technology can help us as well. There are some great new apps coming out for the iPhone and little attachments for the outside of the iPhone that can actually give you a readout of your ECG. So one of them is called the iECG, and that's just started in San Francisco with a company, and I just checked on the internet last night, and they're now able to provide you with a case for your iPhone for just less than $200, which allows you to actually record an ECG, not even just a pulse. And so we're reaching the era of personalised medicine and people having control and people having the technology to be able to bring to their GP or their cardiologist these tracings or these recordings that they've done on their iPhone or similar sort of gadget, and tell them, look, this is what I had when I felt a little bit funny, and that can really assist the doctor because we're able to capture more information than just what we examine when we see you in front of us.
So if we're taking our own pulse, should we just be feeling for something that's regular, or should we be counting beats? Really
good question, Naomi. I think you should be doing both. Because we do know that there's a healthy range, which is approximately from 50 beats per minute to 100 beats per minute. And if you're at rest, generally speaking, when we teach our medical students, we tell them that this is the normal range physiologically for the body. If the pulse is slower, it could well be that there's an issue and the patient may need to be considered for a pacemaker, possibly. And if the pulse is higher than 100, then it could well be that the patient has atrial fibrillation. Regularity is really important because in atrial fibrillation we describe the pulse as being irregularly irregular. So it's kind of all over the shop. It doesn't have any rhyme or rhythm to it.
There's a calculation, isn't there? Because I know that if a nurse has ever felt my pulse, she doesn't stand there for a whole minute. Is it you count to? Is it 30 seconds and then do the maths?
Yes. So in my personal practice, in my opinion, I think 30 seconds is the way to go. If you're ever unsure, though, don't hesitate to feel for longer, because you're going to pick up more if you feel it for a whole minute than if you feel it for 30 seconds. I would advise people to avoid doing it for 15 seconds and multiplying by 4, which some people do when they're in a rush, but you can really miss stuff if you do it for such a short period of time.
So 30 seconds, we can times it by 2, and we're looking for something between 50 and 100, depending on whether we've been exercising or not.
That's absolutely correct. So after exercise, of course, we do expect the heart rate to go up to 140, 150 or even higher if you're younger and fitter. And it's not unreasonable to check after exercise from time to time, because some people exclusively get rhythm disturbances at the time that they're exercising. It's not always the case. So it is worthwhile checking from time to time after exercise as well.
Professor, it's been fascinating having a chat with you this morning. Thanks for taking the time.
Thank you very much for having me on the show.
All right, have a great morning. That's Professor Rushan Weerasuriya. He's a cardiologist, and we were talking about the importance of taking your own pulse. You're on ABC South